A pressure ulcer is an area of the skin that breaks down when something keeps rubbing up against it. So it can be anything from a hard, flat, soft, any kind of surface. So what it would look like is the skin would get worse over time, wherever it's in contact with that kind of surface. And the areas will form like blisters, and that could potentially lead them to pop and then increase the child's chances of getting an infection. So most commonly, pressure ulcers occur around bony prominences, so that includes the buttocks, the elbows, hips. If a child is bed restricted, their ears, the back of their ears, and then the head, shoulders, and ankles. So with pressure ulcers, prevention is key. They can be avoided. And a child in a wheelchair, is at greatest risk for developing this because they're in it all day, And then, so you'll want to check for pressure ulcers every day, every chance you get, kind of do a head-to-toe assessment in those areas. And you'll want to check for blanching. And blanching is when you press against the red, like if the area is red, and if you press against it, it doesn't turn white, it stays red, so that's blanching. And then you'll want to consider, changing them at least every 2 hours, promote a good nutrition, healthy eating, well-balanced diet, encourage fluids, so approximately 8 to 10 cups of water a day, and then, exercise daily. You can do passive range of motion exercises, or they can, they can move by themselves, encourage active, so. And then, always keep the skin clean and dry, and use pillows or wedges as, to decrease the pressure in that area. So management. In order to relieve the pressure, you can use those pillows and cushions and wedges to keep the skin from the surface. And then you'll want to avoid further friction. If you need to lift them up, try not to rub them against the sheet. You'll want to watch for signs of infection, so redness, swelling, and warmth.
Okay, now we're going to be talking about Gtubes, which are gastrostomy tubes. These are tubes inserted in the stomach through surgery that provide food or medication, or they can be used to vent the child's stomach from air or drainage. And this is actually a Gtube. And when you're going to look at it, this is just going to be the part that's sticking out of the child's stomach right here. And then we have this attachment is what we use to attach. And then we can instill medication or fluids or whatever they need, or if it's clogged right in here. You will not have to give them medications or fluids, but you are going to be seeing Gtubes, so it's good to know what it looks like, and it's just a little easier to visualize it. So I'm going to pass it around. Feel free to play with it. So when we're talking about Gtubes, what you need to be aware of is that the child shouldn't be pulling on their Gtube. I'm sure, if they're bored in class or something, it's going to be really tempting to play with, but make sure that they're not messing around with it or playing with it. And it's just really important for you to be just monitoring them and watching for complications. We talked a lot about infection before, and Gtubes are one of those things that we need to watch for infection. So you're going to be looking for redness, irritation. Do they have a fever? Is there an odor coming out of it, or a yellow or green drainage? Are they bleeding? It's if excessive blood is coming out of it, or are they having vomiting and diarrhea? Those are all, potential problems. So if that would happen, you would need to have a plan in place with the school nurse, the child, and the parents of what to do. But I would first notify the school nurse and then take steps from there. So other problems, if the Gtube would come out, this is a problem and obviously an emergency. So you should have some supplies in your classroom. So you would take a clean gauze strip and tape it over the area. And then we would need to, again, notify the nurse. We would probably have to notify the child's parents and guardian or the physician. So once again, it's good to collaborate with the nurse and the parents to have a plan in place of what's going to happen if this happens. Even if it would never occur, it's good to have something in place so you know what to do and you can feel confident about it. So if the Gtube would start leaking, we need to inform the nurse so that the the dressing can be replaced because any leakage can cause skin irritation and lead to further problems. Or if there's any redness or irritation or it's clogged, you're going to contact the school nurse. If it's clogged, the school nurse can flush it and try to make it a little bit better for the student. So next we're going to be talking about trachs. A tracheostomy tube is a surgical opening. This is actually my friend Trach Tom. This is what a trach looks like, and it has these nice straps on it and this dressing behind it. This is basically used to provide them another airway. You know, if there's been an injury or a condition in which like their trachea, windpipe, or normal breathing passages are blocked or there's something wrong, they need another way to get air. Or it also can be used because if the child has a condition that makes draining secretions really difficult, they're going to need this. And this opening in the neck is also called a stoma. Problems that can occur would be respiratory problems, so that's the main thing you want to be watching for. And really, you're going to have to just be noticing them. They're going to be coughing, or they're going to have sweaty, clammy skin. You know, when you're not getting air, it's anything like that. So their color is going to change. They could be blue or gray or turn pale, wheezy, like that noisy breathing we talked about with asthma, or they're going to be, you know, restless, like looking irritated, or just have flaring nostrils. Like honestly, you know, it's kind of a gut intuition. Does the child seem like something's wrong? Do they seem off? What is happening? So if this would happen, this is an emergency because they need air. And you would just want to stay calm, and you'd want to reassure the student so that they stay calm, because anytime they have more anxiety, they're going to have a more difficult time breathing. So you just want to come and look at the trach, and I encourage you to come look at Trach Tom later, because the more you look at it, the more familiar you'll become with it. And so don't leave the student alone ever, and because this is an emergency, so we're going to need to contact, you know, if it is truly respiratory distress, we need to call 911 because they need to go to the emergency room. And we would, again, you'd probably have a plan in place with the school nurse and the parents. Like, I can't stress how important that is to have a plan ahead of time instead of waiting for something to happen. So other things to watch for is if they're having like increased secretions, or they're really thick, or if they're, again, having fevers or crusting or leaking or bloody secretions. You just want to make sure this looks dry and clean. If not, they should probably go see the school nurse, and just be aware, just be monitoring them. It's really just hypervigilance with these children is the best thing that you can do. And you're also going to have an emergency kit just in your classroom, and there should be one in the school nurse's office as well, just so you're aware that, you know, you have this in place, and again, you have a plan in place of what would happen. But the main thing to look for is signs of respiratory distress. The next topic we're going to talk about are catheters, which you may have heard of before. These are tubes that are inserted into the bladder to drain urine. This is a Foley catheter. I'll pass it around. This is inserted into the urethra, and then here is where it drains out into this bag. So the child may have this, so I'm going to go ahead and pass this around. Or there's a suprapubic catheter, which is a catheter that's inserted into the top of the bladder and through the lower abdomen. And then children can also be like intermittent catheterized, and basically that means they aren't going to have a catheter always in, but they may just go to the bathroom and then insert a catheter, empty their bladder, and then come back to class. So when you're talking about that, you know, you have to make sure that if they are being, like, if it's intermittent for them, that, you know, sometimes kids need a reminder. So, you know, every day at a specific time, or like, you know, silent reading time, or right before lunch, make sure that they're getting up and going to empty their catheter. And they may be able to do this by themselves, or they may need assistance from the school nurse. But in all types of catheters, if there is a bag, you need to make sure it's below the bladder, so it's like down on their leg. And make sure the child is drinking a lot of fluids a day. They need to be able to, you know, really flush their bladder. And the child should be checking the bag every 4 hours or so and emptying it, because it does get full. And again, the child may be able to empty the empty the bag themselves. It really just depends about their functional level. And again, that's something to discuss with the parents, the school nurse, and the child. Develop a plan, what you're going to do, what system's going to be in place. Are they going to go empty it themselves every day? Or are you going to help remind them? Or what's the best way? And you just want to monitor for kinks or bends in the catheter, and you know, you see the tubing there. You want to make sure that that's able to flow at all times. And again, we're looking for infection or any problems. So fever, is there a smell? Is it leaking? Are they vomiting? Are they having chills? Is there any blood or really dark urine, or like a significant change in what the urine looks like, really cloudy or really dark? Or is there no urine at all throughout the day? Just things to be monitoring for. And if we would come across any problems, again, notify the school nurse and she would take the next steps or notify the parents. So then we're going to talk about a central venous catheter, which is a CVC. And these are basically used for medications or drugs or drawing blood in IV nutrition. So CVC Care, it's really important that it stays dry and that the child, again, it's tempting if something's sitting right here just to yank on it and pull on it. We don't really want them doing that. And children with CVCs should avoid contact sports. Even if they can do a lot of things, but if they're on the playground and they're trying to, play football, roughen up, it's not a good situation. It could lead to problems. And at all times, they should have an emergency kit with them no matter where they go in case a problem would happen. And this emergency kit is going to have tape, clamp, gloves, and gauze. So it's important that you know that they have that with them at all times. So a couple of emergencies: if there is air in the central line, the child may become short of breath, or if there is blood backing up in the central line, like if you notice blood all of a sudden coming, this is a problem, so you need to clamp it. So again, in that emergency kit, there'll be like a pair of clamps, like scissors, and you just need to take it on the line and clamp it. The line looks like a little tube. You just need to clamp it where the problem is. And then you need to call the school nurse, and she will assist you and go from there. But again, if the child's having difficulty breathing, anytime they're having difficulty breathing, this is an emergency. We need oxygen, we need air, call 911, and honestly, use your judgment. If you think it's if you can tell they're having trouble breathing, you'd rather call and be aware than just say, oh, it's probably okay. Just trust your judgment. So another emergency is a broken or cut central line. If you notice blood leaking from the central line or witness the damage, again, you need to clamp the central line. And if any part would break off, you need to take that and put it in a bag right away because they're going to need that at the hospital. Or if the central line is completely pulled out, this is when you would, again, get in that emergency kit, pull out gauze, apply pressure, and keep it there, and get tape and call the school nurse. And that child's going to have to go to the hospital, and once again, take the line and put it in a bag, because when they go to the hospital, they're going to want to see that line and see how much of it has fallen out. So it's really important that you're just aware of what to do, what steps to take. You need to apply pressure with gauze. And anytime you are touching anything like that, again, we talked about gloves. You need to make sure you put them on, just because of risk of infection and protect you and the student. So again, once again, we're talking about signs of infection. So you're going to see this over and over and over. So it's the fevers, chills, like any trouble breathing, swelling or drainage, any bad odor. Or if the child comes up to you and just says, something doesn't feel right in my chest, or you can tell that the dressing is becoming saturated, that's a problem. And if they do have a dressing on and you notice that the dressing is bloody, or it's not intact, it's all crinkled and ruffled, or just it doesn't look right, then they should be going to the nurse's office to get that fixed, because the dressing should always be clean, dry, and intact. That's what we really want. So then a colostomy. An ostomy is a surgically created opening in basically the abdomen, so that they take a portion of the bowel and bring it to the skin, the intestine. It's basically to help pass a diseased part of the colon. So you're going to see, you see the stoma up there, that's what's sticking out. And it's called a stoma or an ostomy, and they will have a bag that catches all the stool that's going to come out. And it could be permanent, or it could just be temporary, depending what happens and why they have it. So this stoma, it's really important that you are aware of what it should look like. It's red and moist. It should always be red and pink and moist. That is really essential. And it could bleed easily if it's hit or rubbed, but this bleeding should be minor. Also, the stoma should stick out above the skin. As you can tell in the picture, it's out a little bit. It's not even with the skin, but it sticks out. So again, you should be just aware of how, be familiar with what it looks like, because if the unfamiliar can be a little overwhelming, but that's what it should look like. And the skin around it should be free of rash and broken areas. It's really easy for that skin to become irritated with all of those gastric juices coming out, and it shouldn't be painful for the child. If it is painful, again, that's a sign that something's not necessarily right. So they're going to have a pouch, and this pouch, needs to be emptied several times a day, and it should be emptied when it's about a third full or a half full. You may need to remind the child, or again, have a system set in place for specific times to go check it. And, just so you're aware of how to change the bag, how to empty the bag if you would need to, you undo the Velcro, and you unfold the pouch, and then you drain the contents into a toilet, like wipe down the surface and then put the Velcro back together. Again, the child may be able to do this by themselves or they may not. It just depends. Every child is different. And you can have a system worked out with the nurse too as well. It's just good to know in case, something would happen and you would need to be the one to do it. So, and also just so you're aware that you wouldn't really be the one changing the pouch, but you need to be aware of when the pouch should be changed. It's usually every 1 to 3 days. It just depends with the child. If it's loose and starts to leak, or if the child's complaining of burning or itching, or something looks off with the skin around the pouch. So it should generally be changed at home or with the nurse, but again, just be aware, if you're noticing that the pouch really looks like it needs to be changed, then we need to take the steps to do so. So more complications, once again, it's the leakage, the skin irritation, the vomiting, diarrhea. If it's bloody, any output that is bloody, or if the stoma is bleeding and it doesn't stop, that's again a problem. And abdominal pain and cramping. And these kids are also at increased risk for dehydration because our intestine absorbs a lot of water, so they're at increased risk for that. So dehydration, you're going to notice that like their lips and their tongue and their mouth is all really dry. Their eyes are kind of sunken. They're lethargic. They're very tired. They're decreased or darker urine. Anything like that, you need to make sure you're just monitoring that and encouraging them to drink fluids throughout the day. And they need to be allowed to have water and drink throughout the day. And another problem is a stoma prolapse, which is when the stoma gets longer. And this could be due to them like crying a lot or weaker abdominal muscles. It's an emergency. Anytime you see a stoma change from that healthy pink-red color to a dark like purple or black color, that is an emergency, like right away. That needs to be addressed absolutely right away. So that is really what you want to look for this. And you need to call, the child needs to go to the emergency department. That is not a good sign. So just, again, be aware, have a plan in place with the parents and the nurse. And just some considerations, again, they should be avoiding contact sports. We don't want them to get hit. And monitor them for significant changes in behavior, because think about it, if you're a kid and you have a bag full of stool around with you, you may have some, confidence issues, and you may not have the best self-esteem. So it's just good to watch them, especially if it's something new. Just watch their behavior. Is all of a sudden something new? Are they not feeling comfortable? What can we do to, make their adjustment more comfortable? And again, develop a plan to manage like the daily care or emergencies. So what are you gonna do? What's the school nurse gonna do? What's the parents gonna do? What's the plan? And again, monitor for dehydration and any potential complications.
Okay, so I'm going to talk to you about seizures now. A seizure is an electrical storm that occurs on the surface of the brain, and there are different kinds of seizures, so it's good to know kind of a brief overview of what each looks like. An absent seizure is going to be the hardest to identify because it's just a brief loss of consciousness, and it could be a blank stare. The student may just be staring off into space, so it could just be a blank stare, and it could happen quickly, and it could happen multiple times a day. A grand mal seizure is a generalized tonic-clonic seizure, and this is the most common kind of seizure, and it's the most dramatic. When this seizure occurs, you're going to know it's happening. They lose consciousness, there's convulsions, the muscles become rigid, and there's tongue biting, and usually the student will be incontinent. And the most important thing for this kind of seizure too is making sure that the student is safe, because they could choke on their own saliva, they may be vomiting, so you just need to make sure that this student is safe during this. A myoclonic seizure is sporadic and there's jerking movements. A clonic seizure is repetitive jerking movements. And a tonic seizure is where muscles become stiff and rigid. And then an atonic, there's just a loss of muscle tone. And with the myoclonic, a student could potentially just drop something, or there could be involuntary throwing of objects. So if a seizure occurs, the main thing, like we've been saying, is stay calm, because even if the student is unconscious, you want to make sure that everyone else around you is calm. And also, if it's possible, if the student that is having the seizure has an aide or someone that helps them, you stay with the student and have the aide go get help. If the student is standing up and you see that they're going to fall, or if you see that they're beginning to have a seizure, just try to catch them and gently guide them to the ground. And make sure that there's no furniture around them, and just make sure that other students and people are away from the student while the seizure is happening. And try to position the person on their side. This is going to keep them from aspirating and choking on their own spit or saliva, and if they vomit. And the biggest thing too is don't restrain the student down. Make sure that they're free to have the seizure, because the restraining could cause more injury than good. And after the seizure, the child's going to be tired and it wears them out. So if they need rest, just make sure they're getting rest if they need it.
So the last topic we're going to talk about are DNR order. So it's a medical order written by a physician that states that in the event of a cardiac or respiratory event, that it's the students and the students' families' wishes that CPR will not be performed. So usually people that do have DNR orders wear identifiers, so like bracelets or like medical tags. And so making this decision, it's mostly based upon the person is, near the end of their life, or the illness that they have will not improve. It's a very sensitive topic, and due to the increased number of medically fragile, chronically ill, and terminally ill students that are, attending school these days, it's a topic that needs to be addressed. Each student with a life-threatening or chronic illness should have an IHP, which stands for Individualized Health Plan, and an EAP. So these are developed by the school nurse, the parents, the administrators, the physicians, and the teachers. So you guys will be involved in this planning process. So it needs to include a written DNR request from the parents and order from the doctor. Basically, this order form includes procedures to be followed in the event of that respiratory arrest or that cardiac arrest. And it needs to be reviewed and renewed annually.